All right, so good morning and welcome to our first mini career chat of our 2-day long mini career chat series. This is the career chat on public health, and we have Zachary Ford from the class of 2012, who is a senior program manager at AIDS United, and Sarah Cramer, a 2014 grad, who is a sexual assault prevention and education manager here at Center College for us. So they're both going to talk a little bit this morning about their career fields, what it is they do, how they got from being a center student into that career field. And then we will have time at the end for questions. So for the students with us, definitely be thinking about what you'd like to know from them, because we'll have a little bit of time for that at the end. So we are going to get started first with Zachary.
Thank you, and good morning. Let's see, Clark and Amanda. It's nice to have y'all with us this morning. I was actually curious how many. I was thinking about when I was in college and at home for holiday break, and whether I would have gotten up at 9 o'clock in the morning for something like this. So I really appreciate y'all joining this morning. My name is Zach, or Zachary. I live in Brooklyn, New York, and I am a senior program manager at AIDS United, which is a national nonprofit organization with the singular mission to end the HIV epidemic in the United States. The organization really bridges policy and advocacy work with grant making and programmatic support to organizations across the United States. So we fund and support organizations in all 50 states and then in all US districts and territories. And I really work at the intersection of public health and philanthropy. So I oversee a grant making initiative that grants out about $1 million a year, but then also do a lot of research and advocacy and support to direct service health organizations. But when I was at Center, I knew very, very little about either public health or philanthropy, especially philanthropy. So I graduated from Center in 2012. I studied sociology, and my research at Center really focused on the sociology of social movements. So I did my thesis work in my senior seminar on the anti-discrimination legislation that the city of Louisville passed in the late 90s to protect members of the LGBTQ community. And then after graduating, I moved from Kentucky, where I grew up, to Washington, D.C. to pursue a career just in nonprofit organizations. And over the first 3 years I was in DC, post-graduation, I held a few positions at various nonprofits. So I wasn't exactly certain which department within a nonprofit I really wanted to work in. So I tried several of them. So I did development work, which is fundraising for Planned Parenthood. I had an operations role, which is really kind of the administrative side and financial side of an organization at Prosperity Now, which is a nonprofit dedicated to ensuring everyone in the US has a clear path to financial stability. And then I had a programmatic role at an organization called Jafrita Associates, which is a nonprofit consulting firm that is based in DC. And around 2015, I decided to seek that I really wanted to be at an agency that intersected with my interest in LGBTQ rights. So I sent out a lot of resumes. I applied to lots and lots of positions. In nonprofit world, I used idealist.org, which is a really great website that brings together all the nonprofit job listings. And I went through several interview processes, and eventually I was hired at AIDS United. And I was hired in 2015 as a program associate, which is really, it's not our most entry-level position, but it's the second most entry-level position. And I didn't have a lot of the content knowledge. I hadn't studied infectious diseases in undergraduate. I didn't know very much about HIV or the HIV epidemic as it is currently. But I did have a few years experience in nonprofit work, and I had a strong desire to learn, which I felt made me stand out. AIDS United was also running programming that focused on the southern US, which is where the HIV epidemic is most severe now. And so coming from the South, I think also gave me an edge to that. But at AIDS United is really where I was first introduced to public health and had the opportunity to begin exploring really the complicated and kind of intersecting social and economic and environmental issues that contribute to health outcomes. And I am someone that's living with substance use disorder. And so I really gravitated toward AIDS United's programming that sought to reduce HIV among people who use drugs, which is, again, a field that I knew nothing about. I didn't know that this was like a specialization within public health. But I learned about the history of harm reduction, which if we have time, I'm happy to answer questions about. I also encourage you to look it up because it's pretty fascinating. I learned about drug user organizing and advocacy, and also the harmful effects of the war on drugs, both for individuals and for our society. And then my interest in harm reduction and substance use, it really grew into a passion. I worked my way up at Age United until about this time last year. I was promoted to oversee an entire grant making portfolio, which is called the Syringe Access Fund. And like I said, the Syringe Access Fund grants out around $1 million a year. And it's focused on improving health outcomes for people who use drugs. And it really supports syringe exchange programs, although according CDC says they're syringe services programs now. The language changes a lot in public health and in nonprofit work. If you go down this road, you'll learn that. But the ability to lead the Syringe Access Fund has really been a dream job for me, and one that I really enjoy. I've had the opportunity to contribute to research on innovative harm reduction strategies. So doing research on things like supervised injection facilities, which are things that countries like Canada and countries in Western Europe and Australia and New Zealand have implemented as kind of interventions for reducing infectious disease among people who use drugs, and also interventions that help lower rates of overdose. So they're basically medical facilities where you come in, you bring your own drugs, and you use drugs there under the supervision of medical care and trained nurses and medical staff that can respond to overdose, that can connect you to medical care, can give you tests for HIV and viral hepatitis, connect you to treatment if you test positive, and also connect you to substance use treatment programs if you're interested in that. So contributed to research on things like that, these strategies that really address increases that we're seeing in infectious disease transmission among people who use drugs. I've created tools for community-based organizations around the country that are working to improve health outcomes for people who use drugs. A regular part of my job is training state and local health departments around best practices for working with people who use drugs. And then I partner with the CDC and other federal agencies pretty regularly. Most recently, I published along with the CDC a report on best practices for implementing and establishing syringe services programs. And then just last week, I got this kind of like a humble brag. It was really exciting for me, though. I got to meet with the Biden-Harris transition team for the Department of Health and Human Services and the Office of National Drug Control Policy, and tell them what I thought President Biden's priorities should be next year as it relates to substance use. So that was kind of fun. I mean, and I say it was really Age United's priorities, but still, it was pretty cool. But I will say, I think my career has been influenced by like two pivotal moments. So the first really was the research I did in my advanced seminar sociology course at Center. So I encourage you, like those advanced seminar courses are a really great opportunity to or at least mine was, to really dive into the area that I was focusing on in my undergraduate studies and kind of create a really unique project. And I was drawn to sociology because it allowed me to explore why people felt so negatively toward the LGBTQ community. I grew up in Western Kentucky, a town called Madisonville, if either of y'all are familiar with Kentucky. And I was really interested in why people didn't like gay people because I grew up gay, and a lot of in the 90s, people didn't really, in rural Kentucky, weren't too keen on the idea. But it was, sociology allowed me to explore things like structural functionalism and Emil Durkheim's theory of deviance and kind of apply that to the social change that we saw in places like Louisville as it related to that anti-discrimination policy in the 90s. And that sociology seminar was really the first time that I was able to do that independent research, procure or produce a document that that contributed to a community's understanding of itself and also of its history. So that was pretty neat. And of course, learn the value of qualitative data collection and quantitative analysis, and really to also feel the power of people's stories, and to feel the power of someone sharing their life experiences and how that's kind of contributed to where they're at. And then the second moment in my career was when I first learned about harm reduction, and began to kind of see my own substance use disorder not as a detriment, but as really something that is an advantage. It's a tool of empowerment. It gives me an experience that's really unique in this field that not everyone working in public health or even working in substance use prevention and treatment has, and that experience has allowed me to really um, contribute to like changing people's minds around substance use and the way that we approach substance use in the United States. So I think I've gone over my time, so I apologize, but I'm happy to answer any questions if y'all have them.
And you guys can ask questions now, or if we want, let's go ahead and let Sarah go, and then we can do all our questions at the end. Okay. Thank you, Zachary. That was great.
That makes mine so much easier because I have so much in common with what you just said. So, and I was laughing because in Zachary's field, harm reduction is like a great thing, right? And people who do their jobs are just better when they're harm reductionists and they get to explain to people why that's necessary. And in my job, like I'm also very much a harm reductionist, but that's seen as like a little bit weak, right? It's like, oh, everything should be primary prevention. So I joke with center students, if you go on into public health fields, you'll be like, man, my advisor in college was just such a like the harm reductionist pushover, which is true. But okay, so have either of you been to workshops with me on campus? Yeah, okay. So, all right. So my cat is also driving me a little bit. That's why I'm sitting in the dark. I thought I would be able to avoid him. So like Zachary, I got to public health basically just by process of elimination. When I was a center student, I majored in government. And when people asked me, oh, why are you majoring in government, which is now politics? I was like, I don't know. I don't know. And looking back, I wrote a lot of papers. I think about like healthcare policy and sort of domestic violence laws. But I never really put together that that's what public health was because I didn't even have the language. Like I didn't even know how to Google what I was interested in because I didn't know that that existed. And so immediately after college, I got a job as a school teacher and I was like, okay, this is like maybe sort of a fit, but not totally a fit. And then I had a job as a counselor and advocate as a rape crisis center. And it was like, oh, okay, we're kind of getting there. But still maybe not perfect. And when I interviewed for my first public health job, yeah, I did not know that it was a public health job. So I like talked about student affairs the whole time because I worked at the intersection of student affairs, which is basically like higher education, advising, and teaching outside the classroom, and public health. And so they were like, yeah, everything you said about student affairs was so great. Like, that's awesome. This is a public health position. And I'm over there like Googling public health, trying to figure out what I just interviewed for. Unfortunately, I got the job. And so that set me on the path of working on in public health, what we call IPV, interpersonal violence on college campuses. So whereas Zachary is working with HIV, infectious diseases, and substance use disorder, I do a lot with interpersonal violence, alcohol use mostly on college campuses, but other intersections. Public health is really interdisciplinary. And so there are a lot of commonalities in the way that we might talk to someone about like stopping smoking, right, or having better nutrition are very similar to the ways that we might talk to people about like preventing HIV or preventing interpersonal violence. And so what we sort of do is find best practices across the field, right, of just things that motivate people to change their behavior or things that motivate people to seek help or provide help. And we apply those to a lot of different topics. And then we look at very specific research within our specialties. So I can tell you all like a mind-boggling number of things about stalking on college campuses. I can ruin a dinner party so quickly because I can be like, this percentage of college students actually exhibit stalking behaviors after breakups. It's a continuum of behaviors like blah, 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 and just get really into it. And I think that's a commonality too, is that public health people get pretty excited about what their specialties are. And mine is about sexual assault. So I can ruin a dinner party very quickly, but not all of them are that way. Some of them are like, people are really passionate about helping people find forms of exercise. It's easy for them. And that works with maybe any disabilities they have and a lifestyle that they have. And public health is really about trying to make it so that being well and being successful is easy, as easy as possible for as many people. And so I would say, just in general, no matter what you're majoring in right now, and we can definitely talk about that, if you're someone who thinks that everyone deserves to be healthy and well, there's a place for you in public health because it is so interdisciplinary. And probably regardless of what your skills are, you can apply those to public health. It sounds like Zachary and I are both in positions where we talk to people quite a bit. He's probably building relationships, right? And doing relationship management and kind of helping people make sure that they're doing a good job at what they're doing. I do kind of less of that technical support now and less of that management. And I do a lot of presenting and designing workshops. That was a great thing out of working in education, that I love curriculum now. And I'm actually kind of a butthead about it. So I like can tell you all the things wrong with a green dot workshop and all the things that are better about my workshops, just because I have those strong preferences. Um, but I think it's just kind of about leveraging all of that to help people be healthy and well in some way. And so I have friends in public health who are epidemiologists who maybe only talk to a small team of people. I have friends who work in public health who are biostatisticians who literally don't talk to anyone. And some days that just sounds so nice, right? Like they tinker with the spreadsheet and they send it off to a project manager, and they've done a great service for public health and gotten paid a lot more than me to do it. And they didn't talk to anybody that day. The other thing I'll say about public health is, when I was younger, I always liked public speaking. And so that's something that I work in health education now because I get to do that. And I have some skills in that. Later on, I developed that love of curriculum design. But when I got to center, I was very interested in social justice. And kind of like Zachary, the climate for social justice was very different back then. So I was sort of a rebel without a cause, or I saw myself as a rebel, but I think I just like shook my fist a lot. Um, and public health is an interesting field because things like the marginalization of people are just not really up for debate, right? Like we just know by the health outcomes of how large groups of people that they're not being served the same way. I actually just read a study last week, and this is the most extreme rate that I've seen. So don't take this as gospel, but like that Black children in America are 800 times more likely to die of asthma. And so, like, we don't look at studies like that and think, like, I wonder if racism is real. I wonder if racism is bad. Like, that's a thing that is happening, and our job is to respond to it and help people get those services. So I think if you're someone who like is really energized by proving to people that certain types of discrimination or oppression are real, like you probably wouldn't want to even work here, right? Like I don't think that Zachary wants to tell people that people who are queer are treated differently in America. Like that we start at the place where that's already understood and where that's happening. And so I think that that is really important. But like I said, if you think that everyone deserves to be healthy and well, like, and there's a place for you here. And I think that that's one of the great things about working in a field that is so interdisciplinary and that does incorporate so many different skills and so many different types of jobs. And that has a lot of people like us who kind of landed here just by process of elimination or by sort of a squiggly line. I don't know a lot of people who had a straight line into public health. Is usually people who started in liberal arts backgrounds and kind of wanted to put some research, right? And some quantitative energy behind the things that are important to them. And so now, as someone who cared about sexual assault and consent in college, it feels really good to know, if I implement this strategy over time at my alma mater, we can change behavior, like this very certain type of perpetration behavior by 28%, right? With a margin of error of maybe like 1.5%. That feels pretty freaking good, to be able to walk in with that. So I think that's kind of all probably my overview to share. Do you all want to move to questions, or do you have any questions about that?
This might be, I don't know. So I'm a junior and I'm thinking about like the prospect of grad school. And I don't know if either of you like want to speak to that or like know people who have done that or like I guess just have advice on how important grad school is if I'm because I'm a sociology major, so I'm definitely interested more in like the advocacy side of public health. So yeah, I guess just have you seen grad school like being important in the field, or is it more important to just get like work experience?
It's funny that you bring that up because I just submitted 9 graduate school applications on November 30th. um, I think it really depends. So I like when I was basically right where you are. I knew that I wanted to go to graduate school eventually. I wasn't certain what that looked like for me. And so I took the time to get some work experience to kind of see, because the way I looked at it, I was like, if I'm going to spend this much money on something and potentially go into that much debt over it, like I want to be really certain that it's what I want to do. And so I took some time to kind of do career stuff and figure it out. I've reached a point in my career where basically all the like I really want to work at like a major foundation or a progressive think tank. And so like when I look at jobs at foundations, say like they're looking for someone with a decade of work experience and a PhD, basically for like the level that I would be entering the organization now in my career. And so I've really come up against that need for graduate level education. Which is why I've decided to do it now. And so I'm applying to sociology PhD programs because I really want to be more on like the research and writing side of the work. Right now, I'm very much like in the programmatic support and grant making side of things. And it's a nice role, but it's not what I want to be doing forever. I have a lot of colleagues that went straight from undergrad and then went and got their like master's in public health. And that really kind of put them like a level or two ahead in applications and interview processes. I think if you're looking at like if you wanted to go into a role like within a health department, or your career trajectory was more geared towards like the CDC or other federal agencies, like that MPH would be a really smart thing. I think if you're looking at more advocacy research stuff, that's certainly continuing your studies in sociology or would make sense. I think that for me, doing the career stuff first was what I needed to do. And it's made a lot of sense for me. And I'm really glad I did it. I think that my applications to graduate programs that I just submitted are much stronger than they would have been back in 2012. And so I feel more certain that like today I'll get accepted at a program that's like fully funded and gives me a stipend versus almost 10 years ago when I would have not gotten into one of those programs. So I think it really depends. And I'm curious, Sarah, if you have additional thoughts on that.
Yeah, I have my MPH, but before getting my MPH, I applied to 2 other types of programs and ended up not being able to pull the trigger. And it was one of those things where I was like, oh, I don't know why. I just can't follow through. Oh, they weren't the right types of programs for me, right? And so that was me actually being like, I don't want to. But I feel like in some ways, just in the climate like of center that we come out of, we're just not really allowed to say, I don't want to do that yet. Um, I think in public health, work experience is infinitely more important. An MPH is the type of degree where you can work and earn it at the same time, which is good. An MPH kind of shows if you don't have work experience, especially that you know what you're talking about. So, like, a really important thing for me that came out of MPHs is logic models because that helps me design programs. But that's also something that you can Google. I think that, like, literally just Google image and it'll come up. I think one of the things that people who work in public health and are really, I'll say, good at it have in common is that they are lifelong learners, right? And they are people who are just interested in it, right? This isn't like a 9 to 5. And so it's people who want to learn more about it, because what we do constantly changes, right? People's health constantly changes. And the instruction that I deliver and design at Center is different now during the pandemic than it will be after the pandemic. So it's really like, even if you're in a job, you have to be willing to sort of learn. I'll say, just to say where I am, if you want to work in higher ed, like in public health, higher ed is just very degree snobby. So I wouldn't recommend applying for jobs on college campuses before you have a master's degree, but there are a lot of things that you can do and that people are doing to get work experience. And I think Zachary and I are a good combination, because he wants to work in sort of the writing and research side, and I did that for 2 years and I did not like it. So I kind of want to be more on the ground and working with people. So it's a lot less important for me to have a PhD or any type of academic degree, and to just sort of get that practitioner experience. Know that a lot of you all in the next couple of years will have friends who go directly into academic programs, and they do those full time, and they maybe live on a graduate campus because they're getting their master's degree in something like gender studies, right? Or the next thing for behavioral neuroscience. And this doesn't really have to look like that. And I think also everything that you do in grad school is like real. So you might actually practice writing a grant in a grad school class for a real nonprofit and then turn it in, and that nonprofit may or may not get a grant. And that's something that Zach does all the time in his job. My first job in public health was being a grant recipient and like working on those grant objectives. Or you might look at like some things that we did in grad school. We worked with like the Healthy People 2020 report all the time, right? And you're not citing academic journal articles as much as you're really citing the CDC and state departments of health and like real stuff going on. So it's very much not theoretical. You'll have your foot in both worlds. And actually, I think sometimes people who are completely stuck in theory are like kind of annoying in your MPH program, where you'll kind of be like, oh, come on, sure, like we're about meeting people where they are, right? And in public health, best practices are a continuum, right? So if someone's going to go for a walk, and that's going to kind of help them get their exercise, I'm going to be like, okay, go for a walk. I'm not going to say go train for a marathon, right? Like, that's just silly. I would rather someone do it at all than do it the best way possible. And I think sometimes the theoretical people are like, everyone should run marathons. And we're like, have you met a person? So yeah, I think that's my long answer to expand on what Zach said.
Yeah, and if you're interested in the advocacy stuff, like I would say find agencies that are doing the advocacy work. I mean, Age United hires an advocacy fellow. Like we hire like 2 or 3 a year, mostly like coming right out of undergraduate to do like it's like a few months, and you just do like HIV advocacy work on the Hill in DC. And so I encourage you to look for those opportunities to kind of see like make sure that that is what you want to be doing, because yeah, being in advocacy, being on the Hill, doing that kind of thing, it's a really like certain type of personality. Definitely not mine, but I encourage you to look for those opportunities and look at agencies that are based in DC, because there's a lot of them.
And I agree with not going until you know what you want to do. And I would also say like, it really helps to have some burning questions when you do go, right? That you want to learn about and that are going to guide you and focus you. Because there are a lot of people who maybe go into MPH programs not super interested in things like tobacco cessation, right? Or like the obesity crisis in America. And that's kind of what they end up doing because they don't have this anchor. And Zach and I have both been anchored in very, very specific health issues and very specific populations because we came in with experiences and things that we cared about. And that is really nice and important in an MPH program. Also, you can do an advocacy internship with me in the Title IX office if you want to. You don't have to if that's not if you're not interested in Title IX policy or like help seeking services for survivors, but you can. Sorry, Joy, I probably shouldn't be recruiting in my my session, but I think the internship program here is pretty cool if you want to talk to me about it.
That would be cool. Yeah. Thank you all for your responses. Those were really helpful.
Yeah, absolutely.
Yeah, this has
I
been
concur,
really
because that was my same question. So
Okay, good. Well, Amanda, I wanted to make sure that you had time, we're at time, but I wanted to make sure if you had an additional question, you had a chance, but your question was about grad school as well?
Yeah.
Okay, great. Well, Sarah, Zachary, this has been wonderful. Thank you so much for sharing your time and sharing your expertise with us. So can you guys join me in kind of a virtual, thank you. Well, you all have a great rest of your day. To you students, I hope we'll see you later on at maybe some of the other